Today we want to discuss about our book Inside Clinical Microbiology. So our objective was related to clinical orientation and pictorial learning and MCQ skill and OSP images as well. So let's put the facts. Um, so in the start of each chapter, there is the classification of the related bacteria, like that here is gram positive cocci, and this uh, classification are staphylococcus and streptococcus. Okay, so here is in each chapter the classification is mentioned as well, and bacterial specific characteristics also given in the box, like they can be also in the MCQs, like here is Staphylococcus aureus is non-motile and non-spore forming. Okay, so this is highlighted and bold, and these can be given in these are given in each specific bacteria. These are given for each specific bacterias, and morphology, like specific factors that are representing these bacteria, like in the Staphylococcus aureus, these are grape-like arrangement. Okay, and they are forming yellow golden colonies. Okay, these are MCQs. Okay, next is pathogenesis is mentioned like in this ways. Okay, or other is like here is given the pictorial representation, like there it is representing scalded skin syndrome that is caused by the Staphylococcus aureus. Okay, so then here is given the clinical findings. So in clinical findings, the main points are highlighted. You can wrote in the exams these major headings as well. Okay, so lab diagnostic factors are mentioned in the boxes, and with specific headlines, and in the bolding manners, so we can wrote it easily. And treatment is mentioned that will help you a lot in the clinical orientation in pharmacology as well, related to chemotherapy. Okay, and differential tables are also given, mentioned in the books, and for important one, the differential are also given. um, like here is a pictorial representation, you can guys see. um, Here is, okay, the clear picture, and then mentioned what is given. And other is like here you can see guys. um, okay, so these are arrangement is, you can see. Let's move another. Here is UQ also given, like in each chapter, एंड ऑफ द चैप्टर यूनिवर्सिटी क्वेश्चन जो है वो भी मेंशन्ड हैं, आप देख सकते हैं ये. Okay, so mycobacterium, so it's very important. You can see here is mycobacterium representation, like specific characteristics you can guys watch here. Okay, next is this is pictorial representation related to pathogenesis and clinical manifestation of the Mycobacterium tuberculosis. And this is accurate. Okay, so these pictures can be asked in the university questions, like in OSP. Okay, these pearls are given, like these pearls are very important. If you read these pearls, and this will help a lot in your MCQs preparation. Okay, for each bacteria, अब if अगर कोई बैक्टीरिया मिसिंग है वहाँ पे थ्योरी में तो यहाँ मेंशन होगा easily available. Okay, for each. These are MCQ skills. After reading the pulse, you can solve these MCQs. This is virology part, and again, like in virology, pathogenesis is mentioned, and their transmission is very important and asked for MCQs. Okay, so you can see in the representation like that there is herpes labialis. Okay, so you can remember well where pectoral representation. These are clinical features and lab investigations. Okay, to mention for each viruses that are important here, you can see that pictorial representation. Right. Very important rabies virus. As you can see the pictorial representation of patient. Okay, there is the stages, furious stages, and dumb stage. For hepatitis B, these investigations are important and mentioned in the book. Same pulse point, these pulse for virology. And for mycology, these you can see, guys, beautiful presentation. Um, mycology UQs, and these are pulse for mycology MCQs. Next question is related to parasitology. It is mentioned Plasmodium malaria. So this life cycle is mentioned very beautifully, and clinical features along with their important MCQs, lab investigations. This is parasitology part. And differentials are also mentioned. These are pulse MCQs, and these are pulse. Okay, so everything is mentioned in the book. If you use these books and help you a lot in related to microbiology part.